certain point if I thought we are going to talk about answering question or whatever. So how do we go into
my own money. Nobody sent me. So just personal self motivation. But at the end of the day, I had a lot of, especially thanks to this, they were not giving me face, and then eventually I went to Chikwe. Then he was the director general last week. So that time I was on my way out of the country to go and do my postdoc. And then, he was telling me that, oh, maybe when you come back, this do that, and all this thing. So eventually, I think before I left, I got a response from National Malaria Elimination Program. They were more open eventually. I wrote the letter, and then they follow up my letter, they gave me the letter. And it was that letter I used to write the proposal that won me a grant from Swiss government. So so I said I was going to so eventually I started I did the project in the Swiss, and then when I finished, I came back with the mind that, okay, now we still continue this relationship going forward to be able to see how we can light more in the area of modeling because we are already far behind. UK have started using, I have read books that were written about UK modeling, food amount, all this kind of, they are doing it in US, they are doing it. So I was like, Nigeria, why are we behind? So, but like the challenges is being able to penetrate the public health people and convince them that things are possible. So eventually, I think NMEP opened their door, started working together. Gradually, they brought us into the group, and they made us. Eventually, when we eventually start a center, we made our center national modeling consultant for them. Then began to work with them, and eventually we rotated with malaria consortium, and the group is increasing. Even also as we organize kind of meeting, like a lot of people are getting to know us, and then they are saying, "Oh, what can you do for us?" So I think the challenge initially was that the the feeling that as in mathematics, what can we do? You know. So, but when they saw some few things we are doing, and then we started also using their data. In fact, one of the things that challenged was when we started working, when NCDC was not even responding to me at all, I took their data on MPOS, and then I did a modeling study on it. That was one of the first papers we published in the center in BMC infectious disease, and I sent it to them. When I sent it to them, they are the was it the PA? I don't want to mention the name. The PA to the foreign person now contacted me. Wow, this is a good one of that. So we did the forecast, we did some few things there. So it was there we started picking interest. We shared numbers and a bit of the kind of opens we got. Then eventually we were able to invite one of them to give a talk on one of our monthly seminar on cholera. And then this month we are also bringing in one of them from measles to come and give a talk. Gradually, then in the long run, we started talking about how do we train them, like on modeling. So when I brought in that as well, it also opened their door to me. So that one we are doing, I think before August. we are coming back to Abuja to do a modeling week with them on some vaccine preventable disease with NCDC for like 1 week. So all those things are giving us access into their space gradually, but it was not an easy thing. Because before you were able to convince them and make them to see what we can do, and then it's also important that we're able to prove our works, like some of the paper publication we had, that we really use real-time data. And they saw that wow, we published them in plus one and some plus computational biology, some top journals. And they were like, wow, this thing that we have someone who can do this kind of thing for us like that. So I think those ones really start opening their door to us. Then we started navigating.
Thank you so much, Prof. If I can pick anything away from what Prof just said now, really, that means it's really not a straightforward thing like that, particularly when he talked about him having to spend his money to come to Abuja. I just wonder how much the lecturer is collecting consent down to Abuja to be looking for data. I don't know what Prof was really looking for indeed. I don't know, Prof. You schooled all your days in Nigeria. What were you looking for? Who told you should be looking for data?
Well, nobody, but like what happened was before, I mean, those days when I was doing my PhD, I do go out for meeting, and some of the tools, I can say that, like some of the tools I'm using now that I develop more, I learned them in because of, and those some of those workshops, in fact, I can say a large number of those workshops, they are closed now. We don't give them again. Like in those days, I get to attend some meetings, they are doing modeling with data and all those things. Although when you go there outside, when it comes to white, black stuff, they may not really show you some things. But one thing about me is that once I get those material, I engage in further studies. I get books, I buy books to read so that I can get the nitty-gritty. So I have many books. I invested in books. I use my money to buy books. So and I read books till date. Yeah. So it's not what is going to stop. Till date, I read books in those areas that the white people. So so it was those things that motivated me that when I saw that the only way is that I need to read what they are reading. So if I read what they are reading, I will understand what they understood. So I started reading, and then from there I was able to pick it up because I saw that if I don't do that, we are going to still remain where we are. If we are not taking that step, Nigeria would have still remain where we are. It was the step we took, even though I was telling Simon that if I had to look at the external forces against me and against us, I'm telling you, we will not get. There are people, even this, like there are some people that are supposed to be here, but because I mean their interest is divided, so I felt well, I'm not moved by anybody. What would have prompted me to leave my family and what I do, I'm a very busy person to come and spend 2, 3 days here. Uh, I am not motivated. My motivation is not external, it's intrinsic. So whether you push me or you try to frustrate me, I don't see it. What I want to achieve is impact. So my interest is not even on money. Let me tell you that primarily. My interest primarily is not money. Yes, if it's money, some of the program we do, eh? The bill I will collect from you, you will know. I mean, and there are people who want to get it. But let me tell you, when you good service, you get better money. Money, so if I tell people, some people say the money you get, don't if we tell you, I was telling somebody the amount I pay my PhD students, some people are working at Abuja and not getting it. Yes, if you are working at Abuja, they are in Ekiti. The money they get in a month, even though you are not being paid, some of these guys standing there. So it's not, we are not talking money here. So it's not just money. Is what we are after is impact. The company thing, because if it were money, I would not even be in Nigeria. Yes. I would also have gone and then there was be model as many people have pressed the country. But the issue is that how do we develop our own space going forward? Because I understood that home is always home, whether anything. And if we all say that, let's assume that with the situation we are seeing around us here, I'm telling you, it's enough for us not to continue what we are doing here. Yes, I've tried to come to Abuja many times. Some people have confronted me with money and said, you mean you are not going to give anything? And then you think your program will move on. I said, what do you want me to give? And for me to give the service, to train people and make people get to enlighten and all that. So if that one is not done, then to your turn to Israel. So I think I'll just do what I need to. So we have been frustrated, but the question is, we have refused to accept the frustration and we keep moving on. So and that's why we are where we are today.
Thank you so much, bro. Please let's together for him. Okay, so I will move on to another model because before I now center on public health expert. Now, Professor Bolaji sir, while you were talking the other time, I remember that you started talking about we speaking, maybe we have to start speaking the language of the public health people and all of that. But you know, sir, that modeling as it entails today in Nigeria, the kind of approach that we bring to the current mathematical modeling approach that we have in the country, um, the ability of that kind of approach to meet societal needs is a bit in question. So I was beginning to think that how do we begin to change the narrative? How do we come to the point where, okay, mathematical modelers can begin to speak the language that the society understands, particularly when it comes to applied mathematics? Because sometimes we as the mathematician, even the one you call applied math, you call it applied. But by the time I came from a school that when you see applied math, you see Lebesgue measure, you see it. So, and you say it applied. So how do we begin to really change the narrative, sir? So,
The narrative is already being changed with this kind of gathering and the way the whole thing has gone since yesterday. You will all agree with me that the narrative is already being changed. Let me first and foremost, before I go further, thank the organizers of this laudable program. They have really done very well. Thank you very much. This is one of those things that should be happening from time to time to awaken the academicians and the people from the industry with a view to bringing them together. Regrettably, the government is not spending so much in this regard. And that is why most of the societal problems they are not tackled headlong. It is highly regrettable. So back to what you have said. Like I said the other time, whatever mathematics that we do, the moment the layman or laymen on the street cannot make any sense of it, it amounts to wastage of time. Because it's applied mathematics. It is to be applied to help them to understand complex phenomena, complex processes. And by the time you have spoken that language, because mathematics is a language of the scientists, technicians, engineers, and all sorts of people like that. But the language is spoken and people cannot make sense of it. It's a wastage of time. So that is why we must, as much as possible, find means of making it to be appealing to the people. Number one, by toning down some of these excessive analysis that we do, or even if we do it, we may not show everything, only tell them the result. Because by the time they pick it, I want to remember what happened to me some years back when I wanted to do masters. I wanted to go back to Ethan to do my master's degree. So when I met the professor, you know the professor, but I'll not mention the name. So I went to meet one professor, Professor Moru, who is of blessed memory now. He happened to be a brother to my friend that we graduated together. So getting to him, he easily recognized me, and I told him this is what I wanted to do, this. So he said I should. And I said I pick up the form that he should supervise me because they were tying admission me to availability of supervisor. He now said, "Young man, you are my younger brother. Since you are a friend to my brother, if I will waste your time, why don't you?" He didn't say that initially. He now said he was occupied. He will not be able to supervise me. He now took me to a younger professor. The man was not a professor then, but he was a senior lecturer. He now said he should supervise me. That one, of course, said yes. So he said, "Oga should go now, that you should have directed him to me to state without bringing him here." That's I needed to bring him. That is my younger brother. So he said, "But when you are done, come and meet me back in the office." That was Obasanjo year 2000. And I said, "Come back and meet me in the office." So when Prof left, the man picked. I'm sorry for bothering you with this story, but you will know where I'm getting to there. The man picked two journals from the shelf. And I said, "Bolaki, so go and look at these articles, go and photocopy them, bring them back. Then when you come back, let us discuss them." Somebody who has not taken form, that has not even been admitted at all. So I now made mistake of going to Professor Moru's office before I will go back to my car where I parked. I said, let me say thank you to him so that I can return to I was in Boston Polytechnic then later, so that I was conscious of time. So I didn't remember to return his journal first before going to Prof. So Prof now saw the journal with me. And I said, "What are you doing with these journals?" And I said, the professor gave me the journal to go and make photocopies, and I should come back and come and discuss it. He now said, "Bolaki, you know you are my younger brother. If a waste of time, go to another university. The waste of time there." He now said, "Bolaki, what can you say about these articles?" And I said, "They look like Arabic to me." I told him the truth. They look like Arabic to me. I was only seeing the Y, the S, or the S, the T only. Those are the things I could understand there. Because since I've not taken coursework, taking everything. He now said, "Well, what is wrong with these people that we have been telling that they don't listen? Somebody that has not even been admitted, that has not taken coursework, that does not understand anything. You are not telling him to read the write-up of professors, PhD holders. You know, it is Professor PhD holder that write some of these articles. With somebody that is coming with undergraduate mentality. You know, said this will never work. You know, the Bola, you waste of time in it. This is how you can waste people's time. I will suggest go to Futa. Take your form there. You will see reasonable people there. and of course, I took the advice. I went to Futa. I did my master there. I did my PhD there. I forgot about it. Now, what am I trying to bring out there is that it is high time we started changing our approach to issues. You all know there are those of you in mathematical world. You know that some of our colleagues, they have made the study, the learning, and the teaching learning situation of mathematics to be something not remarkable. They present something that is so tense that you understand. They are not making it to be and in the same way we do our research too. We will write our jargons too much, such that people in the industry, they find it difficult to understand what we are doing. And the moment you cannot communicate in a language that they can understand, you have only wasted your time, because they are the ones to formulate policies and implement the policies that will help the society. You are not the one to formulate the policies. You are only advised, your role is only to be advised. So I said what I said, and I still stand on it, that as much as we will know how to do this mathematics, let us only bring out the summary, conceal them, show to the world only the part of it and the interpretation. Let us dwell more about the applicability and the interpretation of our results in the language that the laymen on the street and the policymakers can understand. So that way, I thank you, Rob. And for me, I'm hoping that this message can be passed across, far and wide, not just in this room.
I hope that our lecturers can hear this message. I hope researchers, modelers, academicians can hear this message that is being passed in this room today. I think it's being recorded, and so we'll circulate wide for us to begin to know that the paradigm should shift. Actually, thank you so much, Rob, for that contribution. Now, in the course of it's always this insinuation, not just only in the course of this training. There's people think that decision making in Nigeria, when it comes to decision making, particularly in policy, public health related policy, is that we really don't make use of research. And so I'll be directing these questions to Dr. Richard to respond to. Really, is it true? And if it is not, what role does research play in public health decisions in Nigeria? Are we really doing research to make our decisions? And so just wanted to speak to this, particularly when it comes to public health decision.
Right. Thank you very much for that question. She's doing her postgraduate research in Taraba State University. So she submitted to the ministry, to the Honorable Commissioner. You know, there's a long process when you're supposed to file to request for data. So she was requesting for data, malaria data from 2015 to 2025 December. And I think she submitted it either a month or two ago. And this is something that should have been given to her in a day. It's an information at my fingertip. So I was even on my way to the airport when they called me at the secret registry that there's a lady here, she came, I was crying, that she's the last person in her entire class. Everybody has almost concluded, but I even to get the data to start running analysis. I said, okay, sorry, I'm on my way to Abuja. When I come back, we'll discuss. No, so that there's a deadline. I said, okay, just snap the letter and send to me. So they snapped it while in the airport waiting for the aeroplane. I got did the analysis to her and sent to her for my account number. I said, no, don't worry. I understand the value of research. There are several other people in the ministry that don't. Had it been they understood that value, they would have known how important the research is. Mostly our interest also is either building hospitals and other things. We are forgetting that there are people that give us the skeletal model that we work on. So I think we may need to find a way to improve on that. But the research is good. And now even after this, my test has been worked on 100-fold. I now realize how hungry I am. So I will do more. I'll go extra mile in putting all these things I've learned to practice. Thank you.
Thank you so much. Okay.
Maybe a platform can be created. I mean, for the intersection of some of us in the academia and you people, so that we can, I mean, when that platform is there, when we make publications, it can be dropped there. And when you two have assignment for us, you can drop it there, so anybody can take it up from there. Maybe we should think in that direction. I'm just thinking about that.
Okay, thank you so much. And I don't know, it's probably intended to say something around it.
Like for this program now, each of the program will do that involve any event, WhatsApp group. There's a WhatsApp group. I don't know what happened about WhatsApp. Kind of. Yeah, maintain.
So, Richard was talking two forms. You know that one of the things that tellers will tell you is that, oh, we don't have the data. And always, I'm looking at how do we in your uh, to speak, we can read what that also the quality of data, which sometimes some people begin to, okay, we feel that the quality of data we have is not so good for it. I have a situation, they must complicate, compound, and the treated malaria is treated with ACC. It's the one that is from the, so in the one, and that's the data you have to work with. So how do we look at all of these things when it comes to, I mean, data, so that we know that whatever we are using our model to capture, we are making something important policy.
Okay, thank you so much for that question. First of all, I want to appreciate the National Malaria Elimination Program for even coordinating this process, and also our partners for making this possible. Having said that, I realized that when I was coming here, that I had about 6 state M&E officers, malaria officers join here, and I've been sitting down. Why are they here? We are over 37. Why did they pick 6? And I said, is it geopolitical zone? Is it where you have the highest burden pay zone? Those states that they are making. So for me, starting with that idea, it shows that data was used to even inform the decisions of sending the state M&E here. Telling you that the narrative, like you said, the narrative has changed. Data that drives the process wherever we go to. And you talked about how data could be, like how we can get reliable data. Was that okay? So at the state level, everywhere, we are not just collecting data as raw facts, figures. When data is used for decision making, that is when data, like we said, where you have applied mathematics, where you have data applied and used for decision making, that is when the importance of data comes in. That is when people, even at the point of generating data, realize that this data that is generating is not just figures. It speaks to human being. It speaks to a health problem and needs to be addressed. So once we can have a lot of people understand that data is important and data is used to make critical decisions in the state, policies will be made that will make sure that the data we are getting is of quality, that you have a quality data.
so much, man. So I think that's it about how, the importance of data. But a follow-up to that is what, again, I have among the question, I said quality of, particularly when you see some things in the data that looks like, is it real? Like the example I gave. So is there a way that the NMEP standardize this data set that are making use of to be sure that what is available public is really what is representing enough?
Okay. The NMBP is doing that because we have standardized indicators that are being used to get this data. So for me, I just feel that there are a lot of things that are put into place. There are like policies for you to even get, to break it down, to get quality data like you talked about, uncomplicated malaria cases and so on. It has to do with the people generating the data, that is the clinicians. He has talked about bridging the gap of bringing in the academicians to work with the program and so on. What we are doing at the state level to streamline data is to train managers, even the clinicians. You could have a clinician say that is even because they're the one offering the services. And when they offer the services translate to data. Now, if they don't believe in the data you're even getting, you go up and say treated cases are more than even the confirmed cases. You understand? They will just look at you and tell you that what they train them in school, once you see someone, the person has those clinical symptoms, treat. But I'm happy that the NMEP is bringing policies into picture that you have to adhere to those policies. And when you adhere to these policies, I feel even the data that is generated will be of quality. So we are not just, when we go out for programs, like you go to generate data, we don't just go like M&E, the data people go alone. We bring in the clinicians, make them understand why data is important. Whatever they are doing, is it important? And then when the M&E are going out, they bring in the clinicians so that the clinicians will also appreciate the fact that this data generated has to be of quality. So with that, those policies are in place from NMEP, the data are standardized, and then I quite appreciate a lot of things that they did in Kebbi State. And I am believing that the hard work in Kebbi State will translate to reality when we have a lot of work that has been done. So I've been asking, even in my state, I was like, before I came here, I was having some discussion. Then I didn't even really know much of modeling. What I knew was, the simple thing I knew was, okay, can we have a way of all these interventions that are being, like the NMEP are bringing in to the state? How is it going to translate into reducing the burden of malaria in my state? There are a lot of intervention. So I knew that for me to get that, I have to strengthen the data that is collected so that the data speaks to the situation in that particular maybe LG. So that I'll know that I could have mixed interventions, not just one kind of intervention, LNI. Does this particular location really need this need? Or are they looking for IPT, intermittent events? Is it what they need, or there are other interventions that should be deployed? So I now like, how do I make this combo? How do I make this a reality? I discussed with the people that I could discuss, and I'm happy to know that with modeling, you can actually forecast, know where to channel the interventions to, and from there, you will reduce resource, as in you cut costs and also time. So thank you very much.
Thank you so much. And the response, okay, to respond to that, I'm also adding for you too. The response thing that indeed modelers must work together with the programs, with the program managers, with the people, the experts, public experts. And I think that one of the things our center started doing last year, going to work with states, maybe it's FBVs now. I think it's a good, particularly to see what goes on at this. Um, Even though we know we are collecting data from the National Malaria Data Repository, but they have understanding of what is going on in their state, and I think discussion can keep on going. So I want to believe all of the managers that are here today. We should not out forming a formidable team that can really look at fighting malaria in the country. All right, so okay, you
Actually, if you can still remember what I picked out. The people that actually generate this data is very important. We should not rule that out. Because if they don't understand why this data is important and what this data is used for, then there is no way you get a reliable data. So who are the ones generating this data? I mentioned they are the clinicians. I've mentioned they are the health workers in the health space. So if we even have this bottom-up approach, we have a lot of them have opportunities to this kind of forum or maybe read on it. A lot of them are taking interest going for masters. Before, you can imagine those health workers, especially at the primary level, they choose. They are now going for their masters, making sure that they try as a public health expert to add value to whatever they are doing. So please, let's not forget the grassroots, the people generating this data. If the nice project that the academicians have is seated in their school and is not used in the public health place, it doesn't solve a health issue. So who are the ones generating this data? I know we are talking about policy. NMEP comes in, SMEP comes in, those are the policy makers and so on. That is where you, like Prof said, you try to understand, you're trying to understand the question, what are you looking for? What do you want to do? But again, trying to understand, please bring in who are the ones generating this data.
Thank you so much. So meaning that I think it's an action point for us. Next time, once we have this kind of meeting, we should also look at the clinicians to target them to bring them meeting. So if yeah. Now, yes, I know you have something to say about the ongoing discussion. Maybe you should first to respond to that before I also ask you further questions, which I've been out for.
Right. Thank you very much. Thank you, Prof, for this opportunity. Intrigued. Although my son will come to your school. He's very young, but I really want him to come and because I love what you're doing. Well done, sir.
Thank you so much.
For data discrepancy, that was the scenario you talked about. It's been a thing of a long time problem in data management in the States. Thank God for the Impact project. For Ekiti State, we had to take advantage of the Impact project for boosting our data collection, the analysis and everything. What we do right from the grassroots level, like you mentioned, for the data collectors, they have a monthly validation meeting, which are supervised by state officers. So we distribute ourselves right from the office. They do this validation. So that has helped reduce discrepancy in data. So when you have that treatment not equal to cases, the state now is reduced. So like we had the state level validation meeting that comes up after the LGA validation meeting. There we look at the data that has been sent to the DHIS. Yeah. So with that, I can speak for Ekiti. We have reduced discrepancies in data for now. So if you're going to work with us, you come to the M&E, you will get good data for your job. Now, not only for malaria, I want to say that malaria so far has done a better job in that than the EPI section, but I know they are coming up. So Impact has helped malaria address that issue of nutrition. EPI, we have done a lot of work with the primary healthcare sector. They are still having those issues in their data, but they're working on it.
Thank you so much. I must say that like we understand as modelers that the quality of data determines the quality of the outcome because it's garbage in, garbage out. So the effort of the impact project is really acknowledged doing this kind of thing, trying to do a data validation and all of those things. I think it will really to help us to really look what we now the question are actually you. I was thinking now, what are your expectations? Okay, people in the academics to meet this expectation. Are the expectation of from us because going forward we should begin to think area.
Thank you very much. Apart from the state level one, I would like to start from the national,
Okay.
the coordination and the national. And I think something was mentioned earlier to my Igbo brother, but something like the national. I think it's time Nigeria had a proper setup for coordination meetings yearly. They should have your team sit with them, the planning meetings at the yearly, the annual plan. And they should even create an office for you in the Federal Ministry of Health, so that at the planning level, they do this plan for everything. You should be projects because if we, like we normally say, if we fail to plan what we plan to fail, so bringing the academicians in at the planning level from the national would help them. We will now bring that down to the state level, like that. That would help. So, policy making would be more effective if we have you in it. Because since yesterday, I've been looking at it, how beautiful it would be for Nigeria if we work with you. Honestly, resource allocation, strategies, and all that. You will need this modeling to help us. But we just pray, we hope the system will accommodate you. Because when we have a problem, we want to continue with what we are used to. We don't want to leave it for some selfish reasons. I want to say that awfully good. For some selfish reasons. So for malaria programming or any other public health issues, right from the planning process would help the system, would bring better results, would help in combating diseases right there. And then I want to talk about that resource allocation, whether money or drugs or anything. Very important in Nigeria because most times we don't really do needs assessments. We decide for the state or for the LG or from the national, and then we bring down products to them or services to them. So if we bring that in, then we'll know which state needs this. And in this state, which of the LGs need this. So that will help in public health system.
Thank you so much. Okay, so Dr. Kati.
Question, please. I want to ask Prof, please. Is modeling as a course, as in schools, is it one of the topic or one of the courses? If it's not, I would suggest that it's being put into the curriculum because there's a lot. It's really beautiful. It's like is the way forward to solve the problem of Nigeria or the problem of public health issues. So if we bring it into, for me, if we can target the young scholars, these people are just coming up. If they understand the beauty of modeling, you're looking at schools, maybe in states where you have School of Health Technology, institutions, nursing, and the rest. So they will grow out of the system with this knowledge. And when they grow, they are now applying it. It's different, it's difficult sometimes to say, you bring it like this for us to appreciate, but if I put this, I think some of them, yeah, from the group, it will also help. And then, for me, like you said, there are things that you also look at to see the attitude. That's why I said, once the health managers or people that are generating the data or using the data appreciate the fact that data is useful, then you solve the problem. While she was talking, we discussed with my colleague. We've talked about data validation. That is the first thing they come out. In fact, we talk about health facility data validation. Start validating from your health facility. Use the data before you even come up to the ward level and the rest. We now look at the people that are entering the data, because that's another form of, that's what you see. You could finish validation, the data is okay. The person entering the data, maybe that particular time the person heard someone shout 1,000. The person will you. Instead of 100, the person gives you 1,000. Are these systems in place? Some of them, as health record officers, they don't even have a laptop to enter data. They are using their phones, where you can't really look at the dashboard. Instead of putting maybe 10 cases, the person will mistakenly report 100. And then you look at this as data quality issues, and then even the response. You at the stage, you've downloaded the data, you've made analysis, you've given feedback to them. Please, this is the issue. Someone validated this data, they didn't see this, correct it. He knows. One week will pass. 2 weeks, if you have the results, you travel down there. If you don't have that, data remains like that. So those are the issues that we see. So we, first of all, at the state level, you want to address administrative issues. Do these people even have working tools? What are we looking at? Are we going to digital data reporting? Are there systems in place to carry that? Then you now look at the response, attitude of health managers to respond to correcting this data. So those are the issues that we see. Thank you.
Thank you so much. This are a whole lot that we are that is in past, and I think for me, I'm going to hand this lastly. I don't know if anybody has question in the audience, we can actually signify. Maybe we take one or two. But lastly, I want to ask Dr. Richard. Now, what do you think is the way forward? Find the SMEP. Many of our SMEP are already here, and then we have seen what modeling can be used. So, what message are we taking home to our states in order to begin that?
Prof has already said the first thing, that leveraging on the existing WhatsApp group. It's very good, as simple as it is. It's something that will go a long way. Then, secondly, I feel, most of our policies come from the top. If we can engage with the Federal Ministry of Health, then let's get it included in policies. There should be a writing to all the states, not just the states that are represented here. We are just a little out of the 36 plus FCT. So there should be a writing to all the program managers in all the state ministry of health that this is the importance of this thing. There should be more collaboration, and whatever message we intend to pass, we may not be able to develop it in just these 2 days. More input would come, even with the engagement with the Federal Ministry of Health, more input will come. so that we can channel it properly to us at the subnational level. There is this knowledge management that was done for DPRS. I think it was done for all the states. It was done geographically in February or so. So this should be part of it. I don't know, there's no time for me to go in depth into that, but I was fortunate to be part of that training, 2 people per state. So it's a kind of a knowledge management. What you don't know, we need to know it now. So it should come from the national, then we in the state would adapt it, then suit it our own locality. So this is my suggestion.
If Prof has something.
I want to add to it too, that it can start from us. Nigerians, we don't write reports when we represent our bosses in wherever we go. So please, let us change narrative. Respect each of you. Put a report, written one, supported with pictures, and send to those who send you here that this is what I encounter. Then when you now put up the report and send to them, wait for 1 day or 2 days. If the boss does not call you for discussion on it, then go to him again and discuss with him. I remember that this worked magic for me in years back when I was in the poly. I started my career in the poly. I used 20 years in the poly before I joined the university. The director in my poly then, he didn't like my face. I didn't know why he nominated me. I didn't know why, although it could be because I was a stubborn person. I didn't know why he nominated me to represent the Polytechnic in one function. But I thank God he didn't regret it. The man is late now. He's a professor from FUTA. They brought him to our poly that time. So when I went to the function, I made sure that I wrote my report as the something finishes that evening. And as I was returning to the poly the following day, or maybe I had 2 days in in between, I made sure I submitted my report to him. When he saw the report, he was surprised. It was something he has not seen in his life. He said, so he called me. So when he now called me, now said, Bolaji, I wanted us to discuss this. He now said, Bolaji, you surprised me that even those people who are your senior, they have been sending them to represent the poly at events. They have never thought it well to write a written report to him. I remember he said so. He now said that he was impressed about it. And I thanked him. He now said, let's all discuss. We now started discussing the issue one by one. And we'll so please write up a good report about what you have found out here, how the whole thing went, and when I follow it up with a discussion with them, so that when they want to formulate policies, they may even call you and say that I want to do this or what is your opinion about it. I think that is the right way to go. Yeah.
So currently, we have a curriculum, especially in the mathematics department, that's modeling is being taught. The challenge is how is it being taught? That's the challenge. So, I mean, the way it's being taught in different schools. So, and that's why, Ikanda is coming in different ways to make, to change the narrative that people come up and then by the time they come to our meeting, see that, oh, this way things are being done. And then we also have plan as we go on to influence, a lot of way the things are being done, even in other places by training trainers and people who are supposed to be. Basically, just I want to say that focusing on the younger generation because anything you are doing and you are not thinking of placement sons and daughters, that is not going to last. That's why we are seeing the need to focus on the upcoming generation and also raise young people who will begin to see these things. So, like some of the people that are facilitated here, they were from few years past, they were not where they are now. The PhD students, some of them and just started coming up. But today they are facilitating a long time with me. And a lot of them are still coming like that. So gradually, as we go on, we begin to change that. It's not something that will happen just suddenly. Eh, yeah, so yeah, so because like another thing I mean that is also will be important is like taking it up to the federal minister and then the NUC and all those things where it will be introduced into medical policies and all of that and be, so those are the other steps we will way forward. Thank you very much.
Thank you so much, and I want us to put our hands together for the panelists. They have done a great job, and they have really pour our thoughts in the right direction. We are grateful. Thank you so much. You may go and have it now, sir, and Mark mentioned. And the very good point to draw the curtain for this program. The program has been wonderful. Just for a way of listening, I want to invite Mr. Simon to just give us a brief just remark as we go. Thank you so much. And we end it from there after that remark. Yes, sir.
Good evening, everyone. I want to, on behalf of Malaria Consortium, thank you very, very much for the time and participation. The part of our initiative to continue to push initiatives towards it's in this kind of platforms that we stimulate ideas that will be able to move forward and bring out initiatives that will eliminate malaria in Nigeria. So I want to appreciate your time these 2 days. You guys are very busy persons, but you found it important to spend your time here. And I believe we've been able to, the workshop was what it, right? Was it? Oh, we just spent time and resources. Okay, so it's good to know. It's valuable feedback that it's worth it. So I thank you very much. And as you go back to your various destinations, I expect that we'll be able to cascade our learnings down to other persons. And I wish you all the best as you get back to your various destinations. Thank you very much.
Yeah, so like I said, I broke mine yesterday, right? I'm sure some will still come, and then the others we can access here.
Sometimes I know the breakfast. Yes, there are some times that maybe they could have some course in the ground, maybe 4 to 6 or 5 to 7 or
Bro, there's something I question can ask you. Especially question.
now that we decided to break all the pillars today, once we know those, we actually follow the spirit of Malaria model. We want to they don't have, they will be